from Patigas from BSN 2 Wedenbach. I'm from student nurse from UNESCO's, and I'm demonstrating today the hot Sitz Bath. And for the definition of hot Sitz Bath, it is the local application of moist heat in which the buttocks, lower trunk, or the pelvic area is immersed in warm water. It can help relieve pain and discomfort in the perineal area, such as affect childbirth or perineal area, such as surgery, and can increase circulation to the tissues and promoting healing. And for the purposes, it allows to aid healing a wound in the area by cleaning on discharges and slough, to induce voiding and urination retention, to relieve pain, cognition, and inflammation in cases of hemorrhoids, tenesmus, rectal surgery, anal fissures, after proctoscopic or cystoscopic exams, sciatica, uterine and renal colic, and lastly, to induce menstruation. And for the assessment, first, review any orders related to the Sitz Bath. Next, determine patient's ability to ambulate to the bathroom and maintain sitting position for 15 to 20 minutes. And third, inspect perineal or rectal area for swelling, drainage, redness, warmth, and tenderness. And lastly, assess bladder fullness and encourage patient to void before Sitz Bath. And for the objectives, first, to relieve cognition in the pelvis. Second, to relieve tenesmus or infectual and painful straining at stool and in urinating. Third, to relieve painful hemorrhoids. And lastly, to relieve pain after cystoscopy, vaginal hysterectomy, vulvectomies or excretion of the vulva, episiotomy during childbirth, and hemorrhoidectomy. And for the equipment of hot Sitz Bath, first, Sitz Bath basin, bath towels, pitcher of hot water, ice cap, and hot water bag, and lastly, the clean gloves. And the first procedure of hot Sitz Bath is check physician's order or Sitz Bath. The rationale for this is to positive identification of the patient is essential to ensure the intervention is administered to the correct patient and identify the patient. Okay, ma'am, good morning.
Good morning.
Can I see your wristband? Your Miss Princess.
Yes, nurse.
Explain the procedure. Explanation relieves anxiety and facilitates cooperation. So, okay, ma'am, I'm going to perform right now a hot Sitz Bath. Is that okay with you, ma'am?
Yes, nurse.
And then, close curtains around the bed and close doors to room if possible. This ensures the patient's privacy. The next step is perform hand washing and put on clean gloves. Hand deters the spread of microorganisms. Gloves prevents exposure to blood and body fluids. Okay, ma'am, as all you know, I already washed my hands to prevent the spreading of microorganism between you and me.
Nurse.
Okay, next is assemble equipment in the bathroom. Organization facilitates performance of the test. Raise lids of toilet. Place bowl of Sitz Bath with drainage ports to rear and infusion port in front. In the toilet, fill bowl of Sitz Bath about halfway full with tepid to warm water. Sitz Bath would not drain appropriately if placed in toilet backwards. Tepid water can promote relaxation and help with edema. Warm water can help with circulation. Next, clamp tubing on bag. Fill bag with same temperature water as mentioned above. Hang bag above patient's shoulder height on or IV pole. If bag is hung lower, the rate of flow will not be sufficient and water may cool too quickly. Assist patient to sit on toilet and provide any extra draping if needed. Insert tubing into infusion port of Sitz Bath. Slowly unclamp tubing and allow Sitz Bath to fill. If tubing is placed into Sitz Bath before patient sits on toilet, patient may trip over tubing. Filling the Sitz Bath ensures that the tissue is submerged in water. Next is remove the patient's clothing and any dressing that are present. Assess the area being treated. Next, clamp tubing once Sitz Bath is full. Instruct patient to open clamp when water in bowl becomes cool. Ensure call bell is within reach. Instruct patient to call if she feels lightheaded or dizzy or has any problems. Instruct patient not to try standing without assistance. Place a cold compress or ice cap at the back of the neck or on the head to help alleviate feeling of weakness. Less amount of blood in the head will cause to faint, and ice cap is applied to cause the blood vessels to constrict so that the blood will remain on the head. When patient is finished, in about 15 to 20 minutes, help patient stand and gently pat perineal area dry. Assist patient to bed or chair. Ensure that call bell is within reach. And lastly, empty and disinfect Sitz Bath bowl according to agency policy. Remove gloves and perform hand hygiene. Pre-proper equipment, cleaning, and hand hygiene deter the spread of microorganisms.
No.
And for the evaluation, first, increase circulation occurs to affected area. Second, increase warmth occurs to area of application. Third, suppression progresses. And lastly, pain is decreased with heat application. And for the recording and reporting, record procedure on patient's chart, date and time bath was given, temperature of water, duration of bath, and lastly, effect and reaction of patient. And I'm from Louie Patigas from BSN2 Weden Batch, and that would be all for this procedure. And thank you.